Hello, Chris Ferrone here, repping the Boston Institute for Nonprofit Journalism. So first, a quick order of business. We got a big 10-year anniversary celebration coming on November 8th in Cambridge. Check it out, binge.news, and I'll remind you about that a bunch. But today, I'm here to talk about a feature that I wrote. I don't get to write that much. I'm an editor these days, desk duty, but this one I got in. Now, it's all part of our reporting on opioid settlement funds. That is money that Massachusetts has received from about 20 opioid makers, distributors, basically the people who gave us the unbelievably horrible crisis that we have had on our hands for decades now. And altogether, these companies, yes, including Purdue Pharma, the one you know about, but also many others, including Indivior, which gave a settlement this year. That's the maker of Suboxone, a buprenorphine recovery drug. They altogether will give about $1 billion to Massachusetts by 2038. Ton of money, hundreds of millions of dollars already flowing. And that's what we've been investigating. Where's it going? Stuff like that. Now, some of our early reporting by John Gerhardt, sent props to John, showed that some of that money was going to law enforcement in ways that it's not supposed to, and also to administration. Those were the first 2 years. More numbers are about to come out. But for now, what we looked at is where this money is not going, which is a little different. Our most recent article by Jacob Schless, fantastic young reporter, and I talked about this, if it's ringing a bell. That was about how McKinsey, a consultant who was among the companies to pay settlements to Massachusetts, among many other states, for the damage done, has done millions more in business with Massachusetts than they paid in a fine, because, that's corporate America. Penalty is always less than the profit. Nevertheless, this time I wrote about, hey, thing that's hanging over my head right now. Guess how much money the Department of Correction is getting for opioid treatment or opioid remediation from this $1 billion in funds? The answer, of course, is zero. So what we looked at is, we didn't just end it there. It could have been basically a one-sentence story, although it took the state weeks to confirm that the DOC, the Department of Correction, is not getting any of this settlement, any of these settlement funds. But we went a little deeper, of course, because that's what we do at Binge, and that's why we want you to support us. But back to the story. So national studies show that more than half of incarcerated people meet the criteria for substance use disorder, SUD. All right, more than half. All right, complicating matters is that, the intersecting impact between drugs, the war on them, American prisons, it's just a disaster. Research by Mass Prison Policy Initiative, or the Mass-Based Prison Policy Initiative, which is based out of Northampton, they show that nationally 1 in 5 incarcerations is for a drug offense. All right. And anybody who knows people behind the wall who have been in this situation, the drugs are just everywhere. It's something that some people are surprised by. I don't know why, whether you're watching television shows or you have firsthand experience or know people, friends or family, that Massachusetts prisons almost everywhere, with some exceptions, are full of contraband. No exception here. So one DPH, Department of Public Health in Massachusetts, study showed that the opioid overdose death rate was 120 times higher. All right, 120 times higher for those recently released from incarceration compared to the rest of the adult population. So these are some things. By the way, DPH, that's a Massachusetts agency. This is their research. They also know that there are new burdens, like, K2 is a disaster in Massachusetts prisons right now. They're aware of all this. In fact, a lot of it is noted in their own research. It's according to the state's own research. The risk of opioid-related overdose is especially high, again, in that immediate post-release period. All damage considered, right? One might think the Commonwealth would dedicate a portion of its drug abatement funding to the Department of Correction. All right. The DOC, by the way, oversees more than 6,000 people in 14 facilities. All right. All at the crossroads of every pill, sublingual film, and powder trend, including abuse of the commonly prescribed medication-assisted treatment agonist buprenorphine that's found in Suboxone. But more on that later. For now, I cannot stress enough that we went through all the budgets, and, we really, when the DOC didn't get back to us right away, we tried to see, is any of this money getting to the DOC? You would only think millions and millions, tens of millions annually flowing through the state to deal with this crisis. This is obviously the nerve center of a lot of that, yet nothing. So were prisons intentionally left out? Listen, I don't know. I'm not throwing conspiracy theories around here, just looking at the text as it's written. Under the state's agreement, the way basically the state says they're going to dole out the opioid abatement funding, there's language such as their support. Let's see, they're spending on equity, on Black and Latino men's re-entry program sites, as well as on expanded access to medications for opioid use disorder and low barrier recovery housing options and other basic needs support. But while the state's commitment to abatement, that's the document, the guiding document I'm basically talking about, which was signed by then Attorney General Healy, who's of course now the governor, Maura Healy, in 2022, it notes an intent to address the needs of criminal justice involved persons, including by supporting diversion and deflection programs. Yeah, it goes on and on. There's a lot of that language, but it doesn't say anything about people who are actually in prison at the moment. And it's just a remarkable oversight, I think, although, of course, maybe it's more intentional. Again, we don't really know. Had some people close to the situation, even they're unclear. This is something that, again, it's not often that we report on the negative, what's not happening. But in this case, I felt it was appropriate because the situation with opioids is such a disaster in the prison. If we're trying to fix what's going on across the state, wouldn't they concentrate on where such a center of this epidemic is located? But not. So again, prior reporting of ours examined, how money meant to defray the impact of opioids and prevent further tragedy has been allocated. This was a little different. And, listen, the problem is bigger than the DOC. Also, we also have houses of correction across the state. That's about, I think, 8,300 people in county jails and HOCs. People with OUD in those settings have to be offered FDA-approved medications, buprenorphine, methadone, naltrexone. It's a little different than the way things work at the DOC. So listen, I'm not saying there's not help. In fact, guess what? Massachusetts spends an extraordinary amount of money on treatment and recovery, but the people we spoke to say it's just not being spent the right way. And I'm not suggesting that this remediation funding, just throwing more money at a problem, always works, but some of the things we're hearing, for example, that there is just a ton of, here, take the methadone, take the Suboxone without the wraparound treatment. Perhaps some of this opioid abatement funding could go to some of that. Now, we understand that some of that is going to to the reentry part when people get out, but not in the DOC, which is just absolutely ludicrous as far as I see it. Of course, I don't editorialize exactly in the piece. That's what I'm here for now, although I think it goes without saying. And, some of the people we spoke to, they just say, here's Matteo Filippi. He's the board chair for an organization called Boston Project Rebound Reentry Services. He says, the system pushes pharmaceutical treatment before other treatments because money is easy to find and less time sensitive. He wrote an email. He said, recovery drugs like methadone keep inmates controlled and show that the DOC is trying to take care of prisoners' health. Meanwhile, many guys go from one addiction to another. He meant street to legal pharmaceuticals. And little is done to address talk therapy and spiritual components of their lives. So I've already taken up a lot of your time. If you're watching this whole thing, I assume you have some skin in the game. I'm happy to answer any more questions. Shoot them at me, but please read this, share it. Articles are already going around with people who, of course, our prison reporting always makes the rounds in circles of people. People have family, friends who are locked up, but we really needed to go beyond that. So share this, share the article, but most importantly, read it, be informed. Let people know about this. When this topic comes up, hit them with it. But I appreciate it. And much more on the opioid abatement funds coming. Talk to you soon.